And then when you're constantly being bombarded with pollution on top of the food that you're eating, which is not evolutionary for you, your defenses go down, down, down. Your threat responses are constantly up. And at the end of the day, when your immune system is looking for a fight, it will find one. So you'll find that this is actually a dysregulation of a beautiful system. And so your histaminergic system, or your hay fever symptoms, or whatever it is actually a sign that your body's trying to help you.
All right, Dr. Lesslar, you cover a lot of different topics on your Instagram, which is how I found you. So let's start by discussing some of the work that you do when you do consults or work with patients in your practice. What are some of the most common health problems that you see?
Oh, okay. So I've kind of set myself up as a complex chronic condition doctor. Patients tend to come to me when they've seen a few other doctors and then still not quite sure why they're sick. And one of the clinics that I consult out of, called Singulum Health in Sydney, is specifically a brain health optimization center. So there I do a lot of neurodegen, psych, brain fitness, basically. So it actually does depend on where the patients find me, and that's how I delineate my practice as well. But essentially it's word of mouth. So a lot of the time the patients will be coming to me for complex chronic conditions.
Got it.
Whether it's, So for example, my entire practice yesterday was CIRS, chronic inflammatory response syndrome, mold injury. I had a dementia patient and I had an allergy patient. So it's quite varied.
Okay. Do you work with anyone who has long COVID?
Oh, okay. Getting into the weeds already. Right. So I'm actually quite friendly and with NCNED, which is the National Center for Neuroimmunology and Emerging Diseases. It's part of Griffith University here on the Gold Coast. They're actually supporting an adjunct position of mine, so I'm applying for that. And they're doing long COVID research at the moment. So okay,
awesome.
we're definitely seeing a little bit of that. But we're lucky, we just didn't see that much COVID in Australia, so our population size is quite small.
Right. Yeah, no, the reason I ask, I just interviewed a doctor out of the UK who dealt with people who had long COVID, and specifically looking at the histamine side of it. So she would look for, specific stressors in the environment, for example, like mold, which can activate histamine, or, even like over exercising, endurance type training will release histamine, and foods obviously will release histamine. And she says that has like a large role in the development of long COVID.
Well, long COVID is actually a post-viral syndrome. And actually, so it's very similar, or has many of the characteristics of ME/CFS. And, to a certain extent, that hopefully means that more research is going to go into ME/CFS. Here at Griffith University, the researchers were the ones that sort of realized that TRPM3, which is the transient receptor membrane potential M3, one of the threat receptors, basically, wasn't functioning as well in ME/CFS patients. And that's why for some subset of patients, low dose naltrexone, or LDN, inhibits a opioid receptor, which inhibits TRPM3. And so that's one of the treatment modalities that we're using for ME/CFS patients / post-viral syndrome / long COVID. Yeah, so histamine, look, I think because, histamine intolerance has been a big deal now for about 5 or 6 years since it came to the consciousness of the average practitioner. It definitely has something to say about it. It really does affect, for example, sleep patterns, tolerance to foods. It can make PMS syndromes worse.
Wow.
But I think definitely the long COVID is so multifactorial, and we're only just discovering, every day there's just something new that's coming up about it,
Right, of course. Yeah, no, that was one of the things which, as I started to dig into some of the research, really shocked me. Is just it's not just like a vitamin D deficiency. It's not just like one thing. It's so many things put together that make it so hard to pinpoint an exact cause.
Yeah, like most complex chronic conditions, you know,
Right.
and unfortunately, the way that medicine is set up at the moment, it's, you know, when we're doing our RCTs, for example, you can only test one thing or two if you're lucky, three maybe if you, you know, but essentially, it's really hard to test programs. So, for example, Dr. Dale Bredesen, who is very well known for the Alzheimer's protocol recode, he found it extremely hard to trial his program because he couldn't get approval to do a intervention that was so varied, that looked at lifestyle and food and supplementation. And it's like, no, if you want to do a study, you have to do one intervention, one drug, one supplement, and that's just not how life works, you know.
Right, of course. Yeah, I want to talk a little bit about histamine because you mentioned briefly that it has to do with wakefulness, like sleep cycles. Can you get into that
Mhm.
a little bit more?
Yeah, so actually it depends on which of the histamine receptors you're talking about and where those histamine receptors are too. Plus, it's a threshold thing. So there are four histamine receptors: H1, H2, H3, H4. And most people would know an antihistamine as something that helps clear them up, you know, from a snuffy nose or something like that. And those ones, generally speaking, act on the H1 and H2 receptors. I think most people don't realize, that most lay people don't realize that antihistamines don't actually break down histamine. They stop the activation of the receptor by the histamine molecule. So in other words, when you are constantly on H1 and H2 blockers, you still have all this histamine flying around in your body, but nobody yet has been able to tell me what happens to overactivation of H3 and H4. I think that this is a big deal simply because H3 is found in bone marrow, for example, and the promiscuous use of antihistamines back in the day, 10, 20 years ago, is now sort of biting us in the bum because the older generation antihistamines have been now linked with dementias. You know, they've got this anticholinergic effect as well. So as far as wakefulness goes, the histaminergic system in the brain is one that would essentially keep you awake. The interesting thing that we have in immunology at about 3 o'clock or so is something called the witching hour, where you have a normal dip in cortisol before the slow rise that wakes you up. And you have a normal rise or apex of histamine in your system. So as your previous guest had talked about, you know, the foods that you eat can make a massive difference, because if you have a big histamine loaded dinner, for example,
Mhm.
and you have this normal rise of histamine, and you're slowly breaking down histamine in your body when you're sleeping, come 3 o'clock, you actually tip beyond that normal apex and you push yourself into wakefulness because histamine is going to keep you awake. Now, there are some centrally acting histaminergic drugs that do actually sedate you as well. But again, it depends on where the histamine receptors are and what the load is as well.
Interesting. So histamine then increases cortisol levels?
Histamine has a relationship with cortisol levels, but not absolutely directly.
Got it.
So in this particular case, the scenario is saying that's just the natural dip that's happening with regards to your body, you know. So and that's why even cortisol is very important for sleep and wakefulness, because if you don't have a good enough dip, if the delta of change, how the slope of increase of cortisol is not quite right, your waking up patterns go off. Hence, the whole cortisol awakening response is the measure of how much cortisol increases in your body after you wake up. There's a medley of chemicals at play when you are asleep and when you wake up. And nobody actually knows every single piece to that puzzle, which is why sleep science, thanks to people like Matthew Walker,
Right.
is becoming so popular. And thank goodness we now know how important it is. Because I remember back when I was at uni, it was a big deal for us to stay up late and get all your work done. And, if you went to sleep, you were a loser, or, you couldn't hack it, or those sorts of ridiculous notions. Whereas now, to be protective of your sleep is actually to be protective of your brain. And you eventually do better long term because of that.
Yeah, I have a few things to talk to you about, Dr. Matthew Walker. But first, first I wanted to, so one of the things that my previous guest mentioned is using some antihistamines like quercetin, for example. I'm not sure exactly the mechanism of action of that, but then you're the first person who I think has made the important distinction that maybe something like quercetin could just block the receptors, but not actually degrade the histamine. Is that something that you're concerned about with those type of antihistamines?
No, because quercetin, along with vitamin C, B6, copper, magnesium, and calcium, are actually also mast cell stabilizers. So the mast cell is a type of white blood cell, which actually degranulates chemicals, including IL-6, histamine. And so what they do is that they help the mast cell not be as brittle. A mast cell is a white blood cell that essentially it's there to protect us. We get these symptoms of hay fever and other uncomfortable symptoms here because these are your guardian sites. If something is going to get into the body to cause us grief, it's going to get in through this area because your skin is meant to be integumentary. It's meant to be, foolproof, basically. It's not, nothing's going to get in unless you have a cut. So that's why we have extra mast cells or extra white blood cells, around the eyes, the nose, the mouth. And when you breathe in, for example, a pollen, and your body goes, whoa, what's that? It will do everything in its power to prevent what it thinks is an enemy from entering your lungs. So it'll increase mucus to wrap itself around the pollen. It'll make you sneeze. It'll swell up because it's bringing more of its friends to the fight. And it's going to possibly even cause you a little bit of constriction here so that you don't breathe it further into your lungs. I mean, this is a beautiful, beautiful evolutionary primal mechanism to save us. And so for people who have very poor gut health, who are living so far from their evolutionary life that you're constantly getting threats all the time, you're in a sympathetic dominance, you're constantly fighting with someone at work, you're constantly fighting with someone at home. And so these people tend to have exaggerated threat responses. And then when you're constantly being bombarded with pollution on top of the food that you're eating, which is not evolutionary for you, your defenses go down, down, down. Your threat responses are constantly up. And at the end of the day, when your immune system is looking for a fight, it will find one. So you'll find that this is actually a dysregulation of a beautiful system. And so your histaminergic system, or your hay fever symptoms, or whatever it is actually a sign that your body's trying to help you. And when it goes out of whack, you have to ask why, as opposed to, oh, so annoying, take antihistamines, take more drugs. No, like, what is your body trying to tell you? How is it a reflection of your inability to cope with the stressors of life right now? Because that changes, obviously. Right. And how is your gut health reflected in these responses too?
Right. And not to throw too much crap on modern allopathic medicine, but that's pretty much that's the traditional approach. It's viewing the body as if it's sort of broken, and the only thing you can do is mend it by basically numbing some of the symptoms that you get. Yeah.
And I understand absolutely the roots of that, because the average person was, generally speaking, fit and robust. And so when they were not fit and robust, you would just patch them up because they get over their little hump. Well, they get over their little hump or they die. But anyway, you get over their little hump, and they go back to being fit and robust and working in the fields and, this and that. So I see where it comes from. And that's why the new wave of complex chronic conditions, multifactorial, you can't just put a Band-Aid on it, is certainly rising, and why it needs a newer approach from medicine. Not just integrative practitioners or naturopaths or whoever. Allopathic medicine too. We've got doctors have so much to offer. It's just a different way of approaching a problem that we have to embrace, learn.
Yeah, I want to dive a little bit deeper on what you just said, that people, for the most part, used to be more fit and healthy than we are now. And obviously, this is a huge point of contention among people who are more, still in the modern allopathic side, and then versus people who are more on like the ancestral health side. The argument against, living like our ancestors is, oh, but they died so early, right? But then as I started to look into that, it's like, okay, is that really true? What's really true is that the mean was pretty low, right? And that was partially because of high death rate at birth. But if they got past that, then they actually lived a pretty healthy life into their 70s.
Absolutely. So I embrace that too. I am not an anthropologist. I don't study this to the depth that those people do, but certainly that's my understanding as well, because it is, I find it very hard to understand why anyone thinks that the way to a long and healthy life is to put drugs in people. Absolutely, of course, they're so handy when we need them. Right. Absolutely. Right. But nobody wanders around with a statin deficiency. Nobody wanders around with a Panadol deficiency. It's just, it's ludicrous. So the way I see it as well, and at least the opinion that I right now am choosing to embrace, is indeed ancestrally, if you made it past childhood, and if you didn't die to acute infections, you lived pretty well, and it's not just about living long, and you and I both know that. And everyone likes to talk about living long. We've got people surviving in nursing homes and aged care homes now who aren't living.
Yes. They're
being kept alive, and they're unwell, and they have a million pills that's being washed down them. And yeah, they live till they're 100, 90. But is that what we want as a society? So no, and I'm pretty sure most people would say no. I'm pretty sure most people would say no, I'd rather be robust and fit. And ancestrally, that's what we see, right? That people were slim, or rather they were of healthy weight, whatever that may be. They were able to be mobile and move and think in ways that we don't see as well now, I don't think, in general.
Right. Are you familiar with Weston A. Price's work?
Yeah. I love Weston A. Price's work. Yeah.
Right.
And so, actually.
Oh, there you go.
I prepared this earlier. So Weston A. Price's work is exactly where I go to when I'm talking to patients who are concerned about fertility, pregnancy optimization, child health optimization, the number of children who have issues, even something really simple like, oh, my kid's very fussy. I think that that's a clue for us. If a child is fussy, and it's not because, oh, Mary doesn't eat strawberries, so therefore I don't want to eat strawberries. Apart from that, if they're constantly saying no to something or picking some particular types of foods, that actually gives us a clue as to what's happening with their gut microbiome. So, a few years ago, I was reading about the fact that there are some children on the ASD, mm-hmm. the spectrum, who, for example, preference white foods. And for ages, it was a case of, oh, it's because of the color or whatever it may be. But there was also something to be said about the fact that white foods, generally speaking, tend to be processed. And processed foods are much easier for children who've got very poor gut diversity to break down and consume, because it doesn't give them pain when they eat it. And when they're so young and unable to express the fact that if they eat a bit of meat, they get a tummy upset or anything like that, after a while, it's a very learned subconscious behavior. So if your child is craving certain foods or rejecting certain foods, it's sometimes it's a clue.
That's fascinating. I've never heard of that.
And you know, the older people get, the more that they succumb to things like marketing and all that. So it doesn't quite work. But for kids, yeah, I try to at least observe that, because I want to know, is that a clue, or is that just a preference because their friend said so, or they saw it ad on TV or whatever.
Yeah, no, that's something that I talked about. I'm not sure if you're familiar with Dr. Stasha Gomenek's work. She's
I know
a
Sasha.
neurologist. Yeah, she has some fascinating theories about sleep, gut microbiome. And I interviewed her a while ago now. And that's one of the things that she was mainly, emphasizing, was that abnormal gut microbiomes, which are now kind of normal, I would say. Gut issues are very, very prevalent. And a part of that is because, vitamin D levels and B vitamins, and passing that down through even, generationally, not just in like nutritionally, but, in certain habits, like not going outside, not being in nature.
Constantly being disconnected from the earth, wearing
Right.
shoes, being on a bed and not on the ground. Absolutely.
Right. Yeah. Could you talk about that a little bit? Because I feel like, because you're referring to grounding, but I think most people are still kind of like, oh, that's kind of weird. Like, the reason that I got into that was because I worked a little bit with the Environmental Health Trust, and they do a lot of great work. So could you talk a little bit about that?
Yeah. So there's one thing I definitely speak to most patients about. It doesn't matter what illness they come to me with. And that is about trying to reestablish connection with I was about to say the earth, and it sounds so woo and left of field. But the main thing about that is that it's paper cuts to your system, and it's death by 1,000 paper cuts. In other words, you're constantly putting your brain in a situation where it can't trust itself. So if you are walking on the beach, your skin can feel the wavelength of light hitting it. So it knows it's daytime, can feel the heat, can see the sand, can hear the sea, but it can't feel it. And it knows that the organism is walking forward, right? One foot in front of the other. And it doesn't trust itself, because it's, the majority of our survival and procreation drives are primitive. It's your lizard brain. And your lizard brain is going, what is happening? I don't know. For the average person, that makes very little difference, if any at all. But when you are already in a sympathetic dominance, because you are living in the first world and living in a city and all the rest, and you're constantly being assaulted with chemicals, fake perfumes and car exhaust. And day to day, the one thing that you are meant to do is locomotion, going from A to B. And during that locomotion, your brain doesn't quite understand why it cannot feel the ground in an appropriate way. It will do, there is no free lunch. Your body will do something. So the idea is, L4, L5, S1, the parts of your spine, that's the nerves that come out from that area, actually innervate the bottom of your feet. So part of what the body does, and this is, Dr. Perry Nicholson's type stuff, is that it will try to restrict locomotion, try to restrict movement, because it's trying to keep you safe. What's that? That's lower back pain. That's lower back pain. L4, L5, S1, which everybody suffers. Is it just a brain being confused thing? Of course it's not. It's the fact that we're all sitting down all the time and, this, that, and the other. But again, it's death by 1,000 paper cuts. All these little things mean nothing in and of itself, but you put it all together and you've got a very sick organism. So
Yeah.
I have a big deal with my patients whereby please help your brain to retrust itself, help your brain to retrust the body, help your body to trust your brain again. That is appropriate signaling. If you're walking on grass, you want to see the grass, you want to feel the grass. If you're out in the sun and you can tell that it's daylight, right? Don't put sunglasses on. You're confusing the brain. Be under shade, it's different from having sunglasses on, because your brain is just your brain is really simple. It needs to know, am I safe? And then, can I procreate? Like, is it a safe? Am I safe? It's Maslow's hierarchy of needs. And if it doesn't feel safe, it'll start to do funny things to try and keep you safe in the way that it knows how.
I love that. That might be the title of this podcast episode, by the way, Death by 1,000 Paper Cuts. But how exactly does grounding kind of contribute to better health?
I think that, it sounds like a very woo concept, or put your bare feet on the ground, all that kind of thing. In all my reports to my patients, I actually do have 2 references to 2 journals about grounding, about the fact that it decreases inflammatory molecules, and that they've taken blood and they've seen, right? If you actually ground yourself, that's what happens. Okay. I was speaking to a patient a few months ago now, and he actually worked for Queensland Health, which is a government body that looks after the public healthcare system here. And I was telling him about grounding, and he goes, "Oh yeah." So the radiology companies actually used to advise their staff. I don't know if they still do it now, but certainly they did in the past. They would actually advise their staff, especially if they're working in areas with a lot of radiation, CT scans and all that, to actually go outside, get in the sun, take their shoes off and ground themselves, because it used to help. And that's the idea, apparently, is negative electrons flowing out from the earth into the body, right? And it's just such a simple thing that even if it's not for the express purpose of decreasing inflammatory molecules, increasing negative electrons into your body from the earth, there is definitely something to be said about taking the time out, taking your shoes off, getting your feet on the ground and standing in the sun, in fresh air. And the one thing that I do feel I have to constantly remind myself, as well as talk to patients about, is that because of the way modern medicine has been set up, trying to chase that new fancy drug, that new fancy intervention, and get scalpel to skin, that we forget that the basics of health are what we do day to day, how we breathe, how we eat, how we sleep, how we move, and how we think. But that's not sexy, it's kind of not like even if you want to talk to someone about breathing, you got to sexify it up. You got to talk about Wim Hof, and don't get me wrong, I love Wim Hof, right? But actually, breathe through your nose. Try and breathe through your diaphragm. Try and take longer breaths. Even really simple things like this make a huge, and I'm from first-hand experience, huge difference. So back when I was younger, I was quite sick all the time. I had hay fever and asthma, and I was always snotty and uncomfortable, and I had really poor sleep. And growing up, I then wound up with issues with my periods, and then when I was in my 20s and 30s, I had fertility issues. Anyway, knock on, right? And back then, I was made to believe that it was my genes, i.e., inevitable, i.e., very fatalistic, kind of, it is what it is, there's nothing you can do to change it type of mentality, right? No one actually said those words. But when you say to someone, oh, blah, 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 it's in your genes, what does that mean? floating along the river of life, a victim to your genes. Like, it's just so, come on.
So hopeless.
Anyway, yeah, so
Yeah.
hopeless. And when I was in my, I think I was in my 30s or early 30s, it was, I got Invisalign to straighten my teeth. And because I had this thing in my mouth all the time, I was unconsciously, subconsciously biting down on it. And because of that, I accidentally retrained myself to breathe through my nose, which I never did. I used to be an absolute mouth breather. And that changed my life. I was no longer getting my monthly sore throats. Like, it used to be a bit of a joke that if someone had a sore throat in the next suburb, that I would get sick. You know, and because I wasn't getting my monthly sore throats, I wasn't having antibiotics 2-3 times a year for my tonsillitis. You know, it's changed the shape of my face. I'm definitely getting better sleep. It's just breathing. So, but
Yeah.
it certainly has informed my practice. So I'm so grateful for that experience.
Yeah, that was me as well, actually. I don't think I remember from elementary school up until, you know, late high school, every single year, at least once, I would have strep throat.
Oh, yes,
Yeah.
right. But was it actually strep? You know,
So I'm not sure if they knew always, or they just kind of gave me antibiotics just because they're like, ah, it's something there in the back of your throat. Let me give you some antibiotics.
yep.
Yeah.
So,
Yes. So I'm not
and
sure.
it's the same. It's the same with so many patients that I see now where they have sore throats, and at some point it was strep. But then now every time they have a sore throat, it's strep throat, but they've not actually had a swab in donkeys. And it's the same with women with UTIs, where I get chronic UTIs. Well, what does that mean? Oh, I get UTIs every, you know, month or so, or whatever it may be. It's like, okay, when was the last time you actually had a urine sample which demonstrated like big numbers of these bugs? Oh, no, I haven't. But it's the same feeling. Yeah, interstitial cystitis feels the same way. That's an inflammatory condition, not an infectious condition. And you're taking antibiotics. Oh, but the antibiotics work. Yes, because antibiotics have an anti-inflammatory effect. So I am not against antibiotics. Antibiotics are one of our biggest triumphs medically, absolutely. But you can't give it out like candy. It's not candy, it's antibiotics, right? And you shouldn't be taking a medication if you don't need it. And that's why, you know, doctors like, you know, Dr. Asim Malhotra, the British cardiologist, you know, and he's not against statins. He's against frivolous, promiscuous statin prescriptions, right? And that's kind of how I'm modeling my practice as well. It's like, absolutely, you'll get a medication if you need it. The caveat there is if you need it.
Right, of course. Yeah, that's I think one of the main themes I've seen throughout. Well, it's been more pronounced, I guess. More things have been pronounced throughout the pandemic in terms of people's opinions, obviously. And one of the things have been, you know, the abuse of modern medicine. It's not that, like you said, there have been like incredible triumphs. Like that's why we have a mean life expectancy, which is much longer than we used to have. Because of modern medicine, like surgeries and antibiotics and things like that. But when we start to abuse them, that's when it can potentially become problematic.
Yeah, when we no longer believe in an innate ability to heal. You know, you always need to adjunct it somehow. You always need to add something to it, whereby I do have patients where this is back when I was sort of doing more general medicine, but they'd ask for antibiotics when they were sick. But more than likely, the statistics are that your, you know, whatever cold sign, your issues that you're having are more than likely going to be viral. The antibiotic is not going to work. Oh, well, you know, just in case. No, but patients have those attitudes because the doctors, we've fostered those attitudes. You know, patients feel that they are hopeless unless they see a doctor who then gives them something to take to fix them. Otherwise, patients have lost their autonomy. They've lost their sense of, being able to help themselves along. Honestly, for so many patients, you don't need to see a functional medicine doctor or an integrative doctor. Yes, they have issues with their regular GP or whatever it is. They haven't found help in allopathy. And I get that's why they wind up seeing an integrative medicine doctor. But this is not for everyone. But a lot of the time, you can get yourself to a certain state of health or certain state of healing without seeing anyone, just by focusing on some really basic things. But people are driven to see a doctor because they want a prescription. It doesn't matter if the prescription is breathe better, move better, sleep better, eat better. They still want that prescription. And part of it is patients have lost they've lost trust in themselves. And we've basically, medicine, I feel, including naturopathy, integrative medicine, whatever it is, but I feel like we've beaten it out of people. It's like as if we're the gatekeepers to health. And that's why I kind of welcome the rise of biohackers, because these are citizen scientists who have taken their health into their own hands. Now, of course, there is a safe way to do everything and not so safe way to do everything. And we, of course, have to acknowledge that. But just like how there are some doctors who know nothing about health and everything about drugs, it's the same with biohackers, right? Yes, you're experimenting on yourself with food and movement and all the rest of it. And it's fantastic. But, it can seem exciting or sexy or fun to experiment with peptides or nootropics or whatever. But of course, to be safe and to understand that biohackers also have a responsibility to the many people who listen to them, that they are repeating the mantra that you need to be safe and you need to make sure that you're doing things in a way that's not going to put yourself in any jeopardy, because it's not worth it, because the fundamentals of health do not require BPC 157.
Yeah, I've definitely seen, it's interesting that you say that, because I've seen people who are much less open-minded than you are, doctors and health professionals who are very, they hold a lot of disdain for people who are doing that kind of thing.
Yeah, and so I see a lot of cancer patients, and this is particularly bad with cancer patients, and that is, my mother died of cancer, so I'm very intimate with this. But if you're fighting for your life, the absolute number one question that every cancer patient asks, not just of me, but of their oncologist, is, what can I do? And they are constantly told by many oncologists, there's nothing you can do, right? Just make sure that you come back for your chemotherapy, do your radiotherapy, cut that tumor out. But there's nothing you can do with food, or don't take supplements, that's really dangerous, or whatever it is. Even though the truth is not that at all, right? I'm talking apex journals, blue ribbon journals, which will talk about melatonin as being an adjunct to some brain cancer chemotherapies, curcumin, quercetin even, whatever it is, there is definitely information out there for adjuncts. There is definitely information out there for the utility of diets for cancer, whether it's keto or pulse keto or AIP or whatever it may be. Stop taking away patients' sense of self. Stop taking away their autonomy, right? Because you'll very happily tell the average patient who walks into a GP practice, oh, eat well and don't forget to exercise. Because that's what we're taught in GP, right? That you tell everyone to eat well and exercise, even though most doctors in general don't actually know what that means. That's fine. But you know that eating well and moving is going to be beneficial to the average person, wouldn't it make more sense that it would absolutely be necessary for someone who's fighting for their life? That's not the time where you said it, because I have a cancer warrior patient now. She would have no problem with me talking about this because everything is on Instagram. Her name is Kate, and she was diagnosed with stage 4 lung cancer, terminal, so much so that the doctors actually signed off on her life insurance. And they said, now when she was first diagnosed, and then given 6 months, by the way, when she was first diagnosed, she said to her GP, well, what do I do? I'll stop drinking wine. I'll cut out sugar. I've heard sugar is bad. And the doctor said to her, no, Kate, this is the time when you go home and you have that wine and you eat that chocolate so that you can make memories with your daughter, right? Don't deny yourself all that now. This is when you need that. And that Kate never saw her again. And that's how she wound up finding me later on. But patients, when patients lose hope, that's one of the factors that spirals them into, death or somewhere which is a really bad place. Because we are all animals who, primarily, we're after survival. When you take that away from the organism, when you take that away from the animal, what's that? You take away someone's purpose. So I do find that very distressing when doctors are dismissive of that, because, let me look, personally, of course, I believe diet is very important, but let's just say there's a situation where diet isn't that important. But anyway, let's say diet wasn't that important. The fact of the matter is you have a patient in front of you who's saying, doc, what should I do? What can I do? What can I do? You give them a task, even if it's, okay, well, let's make sure that we're really getting that organ meat in, or that, making sure that the oil that we're going to have is going to be the good oil as opposed to the bad oil. Like swapping out rubbish oil for good oil isn't a huge expense for some patients, but just help get them on board with being the masters of their universe, with getting them at the helm and driving their own ship, Okay.
Yeah, absolutely. No, and I think I think that it's not just the fact that if you lose hope, you're much less likely to exercise, to eat well, to spend time with family, to meditate, to manage stress. That hope in itself gives you a sort of nocebo effect, where that in itself could cause you harm.
Absolutely. 100%, which is why the psychological state of the patient is part and parcel of the fundamentals of health, right? Because you can, and I'm not going to use words like manifest and all the rest of it, even though, yes, okay, that is something that I talk to my patients about. But if you wanted to talk to other doctors, you can't use words like that, right?
Right.
But patients can shape their reality. We all know in hospital the patients who are going to do better than the other patients, and it's the ones with gumption, the ones with get up and go, the ones who have a smile on their face, the one who asks interested questions about their treatment, about their disease, about those who want to know, those who don't harbor anger, those who aren't aggressive, those who have family around them. We know those are the patients that tend to do better. The blue zones is all about that. Right. The blue zones are about having support structures in place, having a sense of purpose, meditating, all those sorts of things. I know that it's soft sciences, but just because it's soft doesn't mean that it's not valuable. And that's what doctors in general have to start realizing.
Yeah, going off of the cancer story, I just interviewed Dr. Thomas Seyfried, and he's huge into metabolic therapies and using ketogenic diet and glutamine inhibition. And that's he was telling me about, because I have a family member right now who had was diagnosed with a brain tumor a few months ago, and luckily this oncologist that we went to didn't give you that, you can't really do anything. But instead, because I have a pretty good awareness of certain supplements, and I've interviewed a lot of really smart people. I know like certain things that may help, and he was one of them. And I was like, I would go to some of the consults with this family member, and I'd be like, okay, is this kind of supplement something that would interfere with the radiotherapy or the chemotherapy, or is this kind of dietary regimen something that would interfere? And for the most part, they would say no. So they weren't saying that it's going to help, but they were saying, oh no, probably won't hurt, kind of thing, which is it's better than saying that won't do anything at all.
Yes. Or saying, no, that's dangerous. And it's like, oh,
Yeah.
why is it dangerous? Or, well, we just don't recommend patients take supplements.
Right.
And when we're doing cancer, look, absolutely, there are 4 signals basically that the cells get: grow, die, housekeep, and sleep. So the sleep senescence, that's a tough one. Housekeep is autophagy, right? Grow is grow, die is die. So when you're trying to give the body die signals, chemotherapy, all the rest of it, Volta Longo was all about that you have to double down on your die signals if that's where you're at in your therapy, right? Which means patients are going to do better when they fast, when you're giving them die signals, because fasting it's a hormetic stress, but at the root of it, it's a die signal. Then when the patient comes out of that die phase and they're into housekeeping phase, autophagy, you promote autophagy. That's why if an oncologist or a doctor says to a patient, there's nothing that you can do, don't bother with supplements and don't bother with diet, the patient goes, oh, okay. And then they go to the internet and they go to Facebook groups and they're going to do it anyway, because they are fighting for their life. And you have to acknowledge that, because you're causing more harm than good by dismissing your patient. Because what patients do is they go, oh, okay, quercetin is good, EGCG is good, vitamin C is good, this is good, that is good, because the list is endless. And then before you know it, they're giving themselves housekeep signals or grow signals when they're meant to be giving die signals, and the other way around. And you're confusing things all over the place. And then these patients don't do well. And you go, oh, well, there you go. It's because they did all that. Dangerous. It's like they did it because they're trying to live. They're trying to survive. And you dismiss them and you didn't help. At least say, I don't know, which is something that I know doctors, including myself, find very hard to say sometimes. I don't know, but I recommend this person. Because there are definitely some hospitals that I've been to, not so much here in Australia, but in the US, where they are all about the holistic care. They are very realistic about the fact that dying people are desperate people, and desperate people need more help, not less.
Right.
I care a lot about cancer specifically, because that is, it's a very, very tough situation. And these are also the people who tend to be the most maligned, the ones who want to do something for themselves. They tend to be the most maligned certainly here in Australia. I don't know in the US, but certainly here in Australia, they tend to be the ones who get given a lot of flack by their oncologists.
Right. Yeah. I mean, that's something that I have, that interest in cancer research is something that I've been forced into as well in the past few months. And something that really shocked me about what Dr. Seyfried told me is that and correct me if I'm wrong, if you have a different opinion, but what he said is that a lot of the studies which show success in chemotherapy or radiotherapy is kind of abysmal. It's like a month, 2 months, and that's what's called a success, adding a few months to a life.
Yep, exactly. And they talk nothing about health span, right?
Exactly.
So you keep someone going for another month or so, but are they living in a way that allows them to do X, Y, Z that they wanted extra time for anyway? No, a lot of the time there's chained to a bed basically because they can't get out without vomiting or something like that. It's not a pretty picture. And until medicine acknowledges our shortcomings and the fact that we, especially with the multifactorial, that it's the epitome of a complex chronic condition like cancer until we realize that we have to be attacking it from a number of different angles. We're not going to get on top of it, you know, and the whole cancer industry is set up. So I shouldn't say industry because it makes it sound like I'm sort of conspiratorial about it or whatever, but the whole cancer thing is set up for that, right? It's like the intervention is this drug, the population that they're going to trial that in, they'll recruit the healthiest people or the healthiest people that they can in that sick population. It gives you an extra month or 6 months and they hail it a success. And then before you know it, it's the next thing that gets shoved down people's throats. And they're told, this is what you should do. Don't try anything else. No, your diet or supplements aren't going to work. So, you know, with the brain health center that I work at in Sydney, Singular Health, obviously we see a lot of brain cancer patients because our CMO, the chief medical officer for Singular, is Charlie Teo. He's a celebrated neurosurgeon who essentially pioneered minimally invasive neurosurgery. Now, when the patients see me, we do A to B, A to Z, and everything in between. In other words, it is, okay, what's your diet doing, your micronutrients, you know, when's the dye signal time, when's the growth signal time, when's the housekeeping, how are we going to get housekeeping up? I absolutely talk to patients about hyperthermia therapy, fever therapy. No patient with cancer gets away without at least knowing about hyperthermia therapy and inducement of heat shock proteins. Patients are also told about pulse electromagnetic field therapy because it's, you know, companies like Voyager. Oh no, what's the company called? The product is called Voyager. Emulate Therapeutics. So the idea of Emulate Therapeutics, and the first time I heard of them was when I was at a brain tumor summit in New York in 2019, is GBM and other brain tumors are really hard to get at because very few things cross the blood-brain barrier. And so what Emulate Therapeutics do, and they're not the only ones, there are lots of companies that are doing this, and the science is exploding, and people better start getting on board with this, is that everything has a unique electromagnetic signature, essentially. And so do drugs. And if you capture that signature, then the patients wear a device around their head like a halo for about 22 hours a day or so. It pumps out the same signature as the drug and doesn't have to worry about the blood-brain barrier. And I think they've done a few feasibility studies already, including one in Australia, interestingly enough. But that's why I actually recommend HapB. So HapB, the device, is actually an Emulate Therapeutics daughter company. And it has the exact same technology, right? Where you've got a certain electromagnetic frequency that you're trying to emulate, and that it does have physiological effects.
Yeah, I've actually seen a lot of the biohackers wearing the HapB for like mood stability.
Yes.
Yeah.
So because it's look, you know, when you have, let's call it a pulse electromagnetic field therapy device, right? The language that you use has to change depending on whether it's a medical device or a wearable, fun wearable.
Right.
But when you have the HapB, or when I say my patients, look, get that and get onto rest and recovery, because that is going to be as close as you can get to a medical device, which is about healing. You can't use the word healing, right, in a non-medical device, basically. Right. And so that's how you sort of circumvent you've got to listen to the language that companies are using. They will sell you a company will sell you the same drug in two different same formulation, but two different packages. One will talk about, you know, a cure for something, and the other one, because they don't get FDA approval or TGA approval or some A approval, and they'll call it something else, but it's actually the same thing. So you have to start getting to know the lingo of these companies too.
Right. Yeah. Yeah. And it's interesting because we talked a little bit about electromagnetic fields in negative light. That's how I was initially introduced, that, you know, it's something to pay attention to. Non-native EMF, like, you know, laptops, wireless devices, you know, all that wireless stuff. But with pulse electromagnetic fields, it's different. You know, in terms of the modulation, the type of frequency that it is can have a potentially positive or a negative effect.
Yeah, and that's the beauty of everything that we do, right? There is everything is not just positive, everything is not just negative. There are ways to leverage these things, and we're so clever. Apparently we're able to figure this out. So, you know, I will use pulse electromagnetic field with patients, absolutely, but I will use like OmniPEMF, you know, a neuro rhythm device, or a HapB, or I'll talk about Emulate or something like that, because most of these devices have those things programmed into it. You know, I'm certainly no practitioner to go, well, I think about this hertz would be good for this. Yeah, I have no idea.
Right.
And it's the same with hyperbaric oxygen, for example. So, you know, I've got a very standard understanding about hyperbaric oxygen. And so my brain health patients will do low pressures for, you know, 90 minutes, for example, 60 minutes if that's all they want to do. But usually low pressures 1.3, 1.5 for about 90 minutes. And they'll do that 2-3 times a week if they can afford it, once a week at a minimum, you know, when we're trying to get them over a certain period of their healing journey. Now, when we're talking about patients who are far more complex, where, you know, like in cancer, for example, the higher the pressures, the more oxidative stress we're talking about, that forms part of the die signal. That's when I'll then go, right, okay, this is getting a little bit complex for me. I'll refer them to Dr. Scott Scher, for example, he's a hyperbaric internal physician in the US. So he's a great friend of mine with regards to, and with regards to these sorts of things, he's absolutely where I would go. That's, my patients will see him. So it's also about knowing when to refer, you know. It's the same with fever therapy or hyperthermia therapy. You know, you got to be really careful. It's a fantastic tool if you use it appropriately, and it can cause some serious harm if you don't. Leverage what you can.
Wow. So when I originally wanted to have an episode with you, I originally wanted to talk about longevity, but we've talked about so many amazing things so far, that honestly, I mean, I feel like, you know, we could have a part 2 sometime in the future and get into all of that stuff, because we're approaching the end. But before we do, I really wanted to ask you about vaccines, because obviously it's something that, for reasons beyond my understanding, has become very controversial, like ever since, you know, they came out. And I've had a lot of different opinions here on the podcast. Different, you know, people I've interviewed have totally different opinions on them. So, as I guess it's a really big question, but as concise as possible, what are your thoughts on the COVID vaccines?
Well, so you know how antibiotics were one of our biggest triumphs, so are vaccines, I believe, right? The fact that we're so clever and we can leverage microbiology and, you know, all that kind of thing. But like everything else, it has to be in context of the patient. And the minute you stop looking at patients, or at least even small patient populations, as and personalizing things for them, when you start broad stroking it across a population, that's when you're going to lose a bit of fidelity, right? So I think that my issue with vaccine mandates, with the vaccine at the moment, the fact that, you know, yes, it's new, and that new doesn't necessarily mean good or bad, but it's new, right? As far as safety data, that's not something that you can you can't lie about that. That's right. It's true, because if you say to someone, okay, how safe is this? It's safe. Fabulous. Can I see the safety data, please? Because obviously there have been lots of things that have been said that was safe. And then 20 years later or 10 years later, and then you can't say I have safety data to prove long-term effects, right? Anyway, I personally will be getting a vaccine. But I'm getting a protein-based old school vaccine. So it's called Covax. It's actually an Australian-made vaccine. That's the only one, I believe, Australian one that's in the running worldwide. So going back to the broad strokes, anything is never a good idea, I think. But more importantly as well, for this particular issue that we're having, this pandemic, the fear that people have means that we need to be holding their hand more, which means that we need to be proving that we care about people's safety, because right now I'm seeing a lack of reporting of side effects that I've in some of the patients that are coming through my door. And these are patients who, they've seen other doctors and they finally come to me and they're sick. Do I think that the vaccine is causing illness across the population? No, so far I think the majority of people are doing pretty well, which is great. But it goes back to, if patients are scared, they need us to help them with more education, not belittle them, not harass them or insult them into getting a vaccine. I don't. It's bizarre kind of behavior, anyway. I'm pretty sure. Well, I'm hoping that I sort of circumvented that question enough.
No, that was very well answered. That's been one of my issues with the mandates as well, especially now that there is some data coming out, although there's some that's not yet peer reviewed, but there is some data coming out that having natural immunity is on the average leads to less reinfection rates compared to just vaccine without infection.
Yes, 100%.
So there's gray area, and like you said, it's not, a blanket statements are rarely the answer.
Yes, and especially if the government incentives or the government hope was for health, was for immunity, then they would seemingly care more about addressing metabolic health in the population, talking about people getting adequate sunshine, adequate vitamin D, those sorts of things, which they don't seem to be talking about that at all. And then the other thing is, if health was truly the issue, or immunity was truly the issue, then they would be backing neutralizing antibody tests far more than they do. Mm-hmm. But right now it seems to be just about vaccination, full stop, end of story. Whether or not you've got natural immunity, whether or not you've seroconverted, anyway, I am trying to stay out of it as much as possible, because it's just such a minefield, especially in Australia.
Yeah, absolutely. Okay. Before we go, I have a few rapid fire questions that I like to ask guests at the end here. But before I do that, where can people go and find out more about you, your website, and your social media?
Yeah, so my website and my social media, including Instagram, where I'm the most active, and Twitter, is Dr. Dr. Olivia, Olivia, Lesslar, Lesslar. So at Dr. Olivia Lesslar. My website is, of course, that as well, drolivialesslar.com. And that has all the different ways that people can get in touch with me, depending on where they are in the world.
Perfect. And I'll include a link to those in the show notes. So number one, what is the most important habit that you personally do every day to support your health?
Wow. Okay. A good bowel movement in the morning.
I think that's a unique one. I haven't heard that one yet. Okay, number two, what is the most important lesson that you've learned recently, whether it be from a book or a life lesson, a study, anything?
Wow. Okay. I would think that it really does go back to basics. I had a very difficult patient recently who had a very difficult illness, and she was, looking for the next protocol. She'd been with a few other doctors And really, it needed to be stripped right back. And that her expectations about getting well needed to be realigned, that it takes time and you have to slowly move the needle. And that's okay, because you don't want to be bouncing up and down, backwards and forwards. So taking it nice and slow and getting back to basics will actually move the needle much faster in the long run for you than to be looking for these quick fixes. And I need to remind myself of that sometimes as well.
Finally, what advice would you give your 20-year-old self?
You need to save your energy for that which deserves you, whether it's relationships or fields of study, yourself, right? I think I didn't spend enough time appreciating me, working on me. I was constantly trying to do things to please family or, you know, make other people happy. And I didn't spend as much time on me as I should have. And that was, maybe it belies a possible lack of, maybe a lack of respect for myself back when I was a little bit younger, because I didn't take the time, you know, to foster all the things that I'm now taking time to foster, including taking time to be still. I never did. I was always go, 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 go. Yeah.
That's huge. That's something that I'm learning now as well. Yeah. All right, Dr. Lesslar, thank you very much for your time. I appreciate the conversation.
You're welcome. Thank you so much for having me.